Radiopharmaceuticals. What are radiopharmaceuticals?
Radiopharmaceuticals are basically pharmaceuticals which have been labeled with radioactive material, a variety of radioactive material. And that radioactive material is basically like a light beacon. That's the one that gives the gamma rays out. Or in the case of positron emission tomography, it's a positron label that gives off positrons. But basically, they act as a light beacon following where the pharmaceutical is distributing in the body. And that's the reason we call it radiopharmaceuticals.
How are radiopharmaceuticals made?
Well, there's a whole branch that we call radiochemistry. And that's a very active, not only clinical, but also research area. In radiochemistry, basically, we design pharmaceuticals from scratch, depending upon what we know or understand about the physiology of question. And then these pharmaceuticals are designed based on that, and then depending upon what that chemistry is, what that pharmacy of that chemistry is, then a radioactive material can be placed in a certain part of that molecule that is chemically stable and is useful. So it's actually a rather complex field, and as I said, there are people who get doctorates in radiopharmacy, I'm sorry, radiochemistry, which designs these kind of things. And it's a very exciting field because we have to understand physiology, biochemistry, chemistry, and radioactivity physics, basically.
What are examples of radiopharmaceuticals?
I'll give you some of the major ones that we use. In general nuclear medicine, for example, we use technetium-99m MDP. That is a tracer that we use for looking at bone metastases or basically bone turnovers. It's used for a variety of reasons, for looking at infection, inflammation, as I said, looking at cancer in the bone. It's a very common radio tracer. We have tracers that are used for nuclear cardiology, looking at myocardial perfusion, for example. Some of them are like technetium-99m sestamib, technetium-99m tetraphosmine, thallium-201 chloride. These are all tracers that are the majority of their use is in nuclear cardiology, although it's not exclusively for nuclear cardiology. There are other applications for every one of these. In positron emission tomography, the most important tracer is F18 fluorodeoxyglucose, or in short they call it FDG. That's the one that we use every day in the clinic, as they call FDG PET. That basically is analog of glucose molecule, and that's a very important radiopharmaceutical for PET imaging. But there's a huge list of radio tracers that are available. These are just a very few that I mentioned that are some of the major ones.
How are radiopharmaceuticals administered?
Radiopharmaceuticals are administered from a variety of ways, mostly intravenously, but also they can be administered orally. They can be administered through puncture into the abdomen, the peritoneal, what we call peritoneal cavity. But as I said, the most common route for administration is intravenous.
What happens to radiopharmaceuticals once inside my body?
Once a radiopharmaceutical is in your body, basically depends on the radiopharmaceutical. That the chemistry of the radiopharmaceutical dictates how basically it distributes in the body, and they go to an appropriate place and accumulate there for us to be able to image them. As an example, for example, if we give technetium-99m sestamib, which is for looking at myocardial perfusion, for looking at how the cardiac muscle or the heart muscle is being perfused, it basically goes to the heart muscle through the coronary arteries. It distributes into the substance of the muscle, and it happens that sestamib is basically goes to the mitochondria, which is a constituent of the cells, and that's how it distributes into the myocardium. It stays there, does not change, it doesn't redistribute, and we are able to make an image of the distribution of the sestamib in the myocardium, which is really dependent upon how well that myocardium is being perfused. So if it's not perfused well because of a problem or a disease in the coronary artery that we call coronary artery disease, then the delivery of this tracer is going to be reduced in the myocardium, and there are not going to be enough of that system maybe in that area of the myocardium, and that's what we see and report as what we call ischemia. There's not enough, there's a shortage of blood to that area of the myocardium.
Are there any side effects of radiopharmaceuticals?
Well, they have been used for many, many decades, and there are some side effects which are very minor. Some, just like any other pharmaceuticals that may be used. For example, there could be allergic reactions, but these are far in between, very rare. And so these are, by far, they don't have a major side effect at all, and have been used safely, as I said, for decades.
Are there radiation risks of radiopharmaceuticals?
There is, because it's radioactive material, so obviously there is some radiation risk, but these are, again, very, very small. It has to be taken into consideration that these studies are only done or administered when there's a need for it. So it's not like everybody goes and have a nuclear medicine study. So if there is a need for it, then of course it is justified to use a small amount of radioactivity through radiopharmaceuticals for making a diagnosis, for example, or treating a patient.
What is physical half-life in relation to radionuclides?
The physical half-life is defined by the amount of the time for that radioactive element to decay to half of its original radioactivity. The physical half-life for F-18, for example, in FDG, is 110 minutes. For technetium-99m in some tracers, for example, MDP or system, maybe that's 6 hours. The physical half-life of I-131, which is used in radioiodine treatment of thyroid cancer, is 8 days.
What is the effective half-life in relation to radionuclides?
I mentioned the physical half-life of the radionuclide for some of the major radionuclides that we use in nuclear medicine. However, the effective half-life can be quite shorter than what I mentioned before, because it also takes into consideration the biological half-life of the radiotracer, which is dictated by the physiological processes in the human body. And therefore, the effective half-life is the more important term in comparison to the physical half-lives that we talked about, taking into consideration the physiology and chemistry of the particular radiotracer, and are generally much shorter than the physical half-lives.